Hi all, welcome to OET Speaking. Today we can discuss an Oet roleplay. Here the setting is a home visit. You are district nurse and GP has asked you to make a home visit to a patient with a venous leg ulcer to see how he is managing. On arriving at home, you find out that he is feeling quite low and unsure about how to cope with the ulcer. Task: greet the patient and ask how he is cope with the ulcer. Explain the importance of layered compression to prevent swelling. Advise that he must still be able to move the ankle around and should check for changes in color, temperature on the foot. Stress the importance of activity. Avoid too much rest, regular walking, leg raise when resting. Ask about his social life and general mood. Advise on local support, special day centers, social clubs, etc. Here, the setting is a home visit. You are a district nurse. As per the GP's instruction, you are going to visit a patient at home. In this situation, you can ask the name of patient during your preparation time. So, you can ask, how may I address you during our conversation? Here, let's assume the name is Mr. John. So you can start your conversation. Good morning. My name is Sarah. I am the district nurse in your locality. Is this Mr. John's house? Sometimes patient may say yes. If he says yes, then you can tell him like, oh, I'm at the right place. Then you can ask, am I talking to Mr. John? Probably the patient may tell you, yes, I'm Mr. John. Then you can tell him like, is it the right time to talk to you? Probably patient may tell you yes. Then you can continue by saying, your doctor has asked me to visit you for the assessment of your wound. Then as per the first task, you can ask like, Mr. John, tell me, how is your wound now? Probably the patient may tell you like, it's little bit okay, but I don't think it's healing. Then we need to reassure him. In this situation, you can tell like, I'm so sorry to hear that. Please try not to worry much about this. It's quite normal to take some time to heal completely. Then probably as per the interlocutor's card, he may tell you like, my doctor has asked me to use a compression bandage. But I am not comfortable after applying this bandage. Is it really necessary, sister? At that time, as per our second task, we need to explain about the importance of layered compression. So you can say like, Mr. John, I understand that you might have some difficulties with this compression bandage. But this would be okay by regular use. Also, it's quite essential for your speedy recovery. The layered compression bandage creates pressure which reduces swelling by moving the excess fluid accumulated, and it can also increases blood circulation. Therefore, your wound healing will be faster. Is that clear? Probably the patient may agree with you. If it improves my wound healing, then it's okay, sister. Then as per our third task, we need to ask question like, are you able to move your legs? Probably the patient may tell you like, sister, I can move my leg, but I lessen the activities with my affected leg in order to encourage healing. In that situation, we can reply as per our third task. So you can tell like, Mr. John, I know you might have scared about leg movements. I assure you that there won't be any problem if you move your affected leg. If you regularly move your legs, for example, moving your feet up and down and rotating at the ankle, definitely help for better circulation. Are you following me? Probably the patient may ask you a question like, sister, can I do movement without any fear? Or is there anything else I need to do? Then we can reply as per our third task. So you can say like, Of course, Mr. John, you can move your legs. Along with, please check your legs regularly for any signs of infection such as any changes in color and temperature on the foot. Then after that, you can tell, I would like to tell you some more recommendation which can help with your full recovery. Is that okay? Probably the patient may agree with you. Then you can reply as per our fourth task. You can say like, Mr. John, it's really important that you need to be active by doing regular walking. Always remember that taking too much rest is not good for your health because it subsides the blood flow to your legs. One more thing I would like to tell you that whenever you are sitting or lying down, keep your affected leg elevated up to the heart level. Are you following me? Then after that you can tell like, I assure you that if you follow our recommendations, you will get much better soon. Probably the patient may agree with your suggestion, so you can tell like, I'm happy to hear that. Then you can ask question like, Mr. John, do you have any other concerns? Sometimes the patient may ask you questions like, sister, how long it will take to regain my normal life? Then we can reply like, don't worry, Mr. John, it will be alright soon with proper medicines and management of your wounds. Usually it will take 2 weeks for the recovery. Then as per our fifth task, we can ask question like, Mr. John, how you are handling your social life? Probably he may tell you like, sister, I'm not active, I feel unpleasant to others, so I cannot interact with others. So we can explain about the importance of being socially active and explain about local support such as special centers and social clubs. So you can say like, I understand how difficult the situation is for you, but nothing to be upset about these leg ulcers. Leg ulcers are common among people and many of them are going through your situation. Please don't feel anxious because it is not unusual. You know, Mr. John, healthy social life is very important and it enhances your emotional well-being and it is really important for your general health. Is that okay if I explain about local support services to enhance your emotional well-being? Then after getting permission from the patient, you can say like, you know, Mr. John, in our locality, there are some social support services available such as special day centers and social clubs. These groups definitely help you to improve your self-esteem and positivity. How do you feel about that? Probably the patient may agree with you. Then you can tell like, okay, Mr. John, I will get the details of it and contact you soon. Then you can wind up by saying, is there anything else I can help you? If there is no other concerns, you can say, thank you, Mr. John. I hope I have cleared all your concerns and I wish you a speedy recovery. Thank you, Mr. John. In this way, you can end up your role play. Thank you.